Hello, I'm Dr. Joe Betz, President of the ICA. As Congress continues to consider H.R. 539 over their August recess, I want to remind everyone that we continue to address an important issue that goes beyond breaking down barriers for Medicare beneficiaries to access chiropractic. Doctors of Chiropractic must be granted the same right to privately contract with Medicare beneficiaries that is already available to nearly every other physician group. This is commonly called the Medicare opt-out provision, but a better description is the right to privately contract. Private contracting allows a Medicare beneficiary and physician to voluntarily enter into a written agreement under which the patient pays directly for care and neither party submits a claim to Medicare. It's about freedom of choice, professional autonomy, and preserving the doctor-patient relationship, not abandoning Medicare patients. ICA, ACA, and MAHA Action through the Chiropractic Hub have agreed to support 3 amendments to the current H.R. 539 bill, one of which is to obtain the right for chiropractors to privately contract with Medicare beneficiaries. Doctors of medicine, osteopathy, dentistry, podiatry, and optometry, the other physician types, already can exercise this right, yet doctors of chiropractic are specifically excluded. In fact, Doctors of Chiropractic are the only physician group recognized under Medicare's statutory definition of physician that cannot opt out and privately contract for otherwise covered services. This inequity becomes even more apparent when we recognize that several non-physician practitioners already possess this right as well. Physician assistants, nurse practitioners, clinical nurse specialists, nurse midwives, clinical psychologists, clinical social workers, and registered dietitians are among those permitted to opt out as a provider within Medicare. Not every allied health provider has that right, however. Physical therapists, occupational therapists, speech-language pathologists, and audiologists also face restrictions similar to those imposed on Doctors of Chiropractic. That is why H.R. 4204, the Medicare Patient Choice Act, may offer the most direct and strategically effective path forward. H.R. 4204 has already been introduced specifically to extend private contracting rights to Doctors of Chiropractic, PTs, OTs, speech-language pathologists, and audiologists. Rather than asking Congress to add an entirely new subject to H.R. 539, H.R. 4204 provides an existing legislative vehicle devoted to this precise issue. It already creates an important alliance also. Chiropractic is not pursuing this reform alone. We can work alongside several other health professions whose patients and practitioners are harmed by the same outdated Medicare restrictions. That broader coalition strengthens the argument that this is not about one profession seeking special treatment. It's about correcting an inequity and restoring patient choice. H.R. 4204 has already been publicly supported by both the ACA and ICA. Whether accomplished through an amendment to H.R. 539, or more directly through passage of H.R. 4204, Doctors of Chiropractic must finally receive the same freedom afforded to other Medicare physicians and practitioners. Medicare beneficiaries deserve the right to choose what provider they see and how they want to pay for their services. Thank you so much, and everybody have a great weekend.